Struggling with weight despite taking your thyroid medication? Let's talk about Tirzepatide and whether it might help with weight management if you have Hashimoto's disease. This video is educational and not medical advice. Always speak with your healthcare professional before starting or stopping any medication. First, let's be really clear about what Tirzepatide can and can't do. Tirzepatide is not approved to treat Hashimoto's disease itself. It doesn't reduce the antibodies attacking your thyroid. It doesn't replace your thyroid hormone medication, and it doesn't modify the autoimmune process. What it is FDA approved for is type 2 diabetes and chronic weight management in people who meet specific criteria. So what exactly is Tirzepatide? It's a medication that works on two hormone receptors in your body called GAP and GLP-1, and these hormones help regulate blood sugar and appetite. If you have Hashimoto's and you also meet the criteria for obesity treatment, your doctor might consider prescribing it for weight management. Those criteria typically include having a BMI of 30 or higher, or a BMI of 27 or higher if you also have weight-related health conditions. Many people with Hashimoto's struggle with weight, and this can remain challenging even when thyroid levels are optimized with levothyroxine. Here's something really important. If you have Hashimoto's and start Tirzepatide, you'll need regular monitoring of your thyroid function. Why? Because if you lose weight, your thyroid hormone needs might change. Your levothyroxine dose that worked perfectly before might need adjustment. This is why working with a healthcare professional, ideally an endocrinologist, is essential. Research shows that people with hypothyroidism often have other metabolic issues beyond weight, like elevated cholesterol, insulin resistance, and increased cardiovascular risk. Tirzepatide may help address some of these metabolic complications, but remember, it's not treating the underlying autoimmune condition. Now let's talk about safety. Tirzepatide has important contraindications. If you have a personal or family history of medullary thyroid carcinoma, which is a specific type of thyroid cancer, or a condition called multiple endocrine neoplasia syndrome type 2, you should not take Tirzepatide. This is absolutely something you need to discuss with your doctor. Like any medication, Tirzepatide can cause side effects. The most common ones are gastrointestinal, things like nausea, vomiting, diarrhea, and constipation. These often improve over time as your body adjusts. Your clinician will determine your individualized dosing and schedule. We won't discuss dosing specifics here. If you're considering Tirzepatide, here's what to discuss with your healthcare provider. First, make sure your thyroid function is optimized. You want your TSH and thyroid hormone levels in the right range before adding another medication. Ask about how often you'll need thyroid function tests while taking Tirzepatide. Discuss your complete medical history, including any family history of thyroid cancer or endocrine conditions. It's also worth talking about realistic expectations. Evidence for Tirzepatide comes from studies in diabetes and obesity, not specifically in Hashimoto's disease. It works best alongside healthy lifestyle changes. And remember, it's not a cure for Hashimoto's. You'll still need to take your thyroid hormone replacement medication as directed. When should you contact your doctor? If you experience symptoms that might indicate your thyroid medication needs adjustment, like feeling more tired than usual or increased sensitivity to cold, your clinician will also review rare but serious risks and when to seek urgent care. Here's what to remember. Tirzepatide is approved for weight management, not for treating Hashimoto's disease itself. If you meet the criteria for obesity treatment and have Hashimoto's, it might be an option worth discussing with your doctor. Regular thyroid monitoring is essential because weight loss can change your thyroid hormone needs. The most important takeaway, this requires individualized medical guidance. What works for one person with Hashimoto's might not be right for another. Always consult with your healthcare professional about whether Tirzepatide is appropriate for your specific situation. Have you talked to your doctor about weight management options? Drop a comment below. And if you found this helpful, give us a like and subscribe for more evidence-based health information.